NLN Nursing NEX Science Study Guide PDF Questions Explained. Welcome to the quiz. Question 1. When a person experiences an allergic reaction, such as hay fever or a reaction to a bee sting, their immune system releases a substance that causes inflammation, itching, and vasodilation. Which chemical is primarily responsible for these symptoms? Is it A. Antibody? Or B. Histamine? C. Pathogen? Or D. Antigen? The answer is B. Histamine, released from mast cells and basophils during allergic, type 1 hypersensitivity reactions, causes vasodilation, redness, increased permeability, swelling, itching, and bronchoconstriction. Antibodies, IgA, trigger release, but do not directly cause symptoms. Pathogen causes infection. Antigen triggers response. Next question. Does the function of the hormone insulin, produced by the pancreas, primarily involve increasing blood glucose levels by breaking down glycogen, or does it facilitate the uptake of glucose from the blood into cells? Is it A. breaking down glycogen? Or B. facilitating glucose uptake? C. producing glucagon? Or D. digesting starches? The answer is B. Insulin lowers blood glucose by promoting glucose uptake into cells, especially muscle and fat, via GLUT transporters and stimulating glycogen synthesis and storage. Breaking down glycogen, glycogenolysis, raises blood glucose and is done by glucagon. Glucagon is produced by pancreas, but opposite effect. Digesting starches is amylase enzyme function, not hormonal. Next question. In the context of microbiology and infection control, what is the term for a microorganism that normally does not cause disease, but can do so in a host with a weakened immune system? Is it a pathogen? Or B. antibody? C. opportunistic? Or D. vector? The answer is C. Opportunistic pathogens, e.g., Candida, pneumocystis, are normal flora or environmental microbes harmless in healthy hosts, but cause infection when immunity is low, e.g., HIV, chemotherapy. Pathogen causes disease normally. Antibody fights. Vector transmits. Remember, we can take your NLN NEX exam for you, remotely and undetected, and with 85% score guaranteed. No fails, no upfront fees, no deposit, pay only after results. Message us via number in bio to schedule your session. Next question. In the digestive system, after food is broken down in the stomach into a semi-liquid substance called chyme, it is released into which part of the small intestine for further digestion and nutrient absorption to begin? Is it A. jejunum? Or B. ileum? C. cecum? Or D. duodenum? The answer is D. Chyme enters the duodenum, first part of small intestine, where pancreatic enzymes, bile, and intestinal juices continue digestion. Most chemical digestion and absorption start here. Jejunum and ileum continue absorption. Cecum is large intestine beginning. Next question. Does the primary function of red blood cells or erythrocytes involve fighting infection through antibody production, or do they specialize in transporting oxygen bound to a protein called hemoglobin? Is it A. fighting infection? Or B. transporting oxygen? C. initiating blood clots? Or D. producing hormones? The answer is B. Erythrocytes contain hemoglobin that binds oxygen in lungs and releases it in tissues. They also carry some CO2. Antibody production is by plasma B cells. Clotting by platelets. Hormones by endocrine glands. Next question. A patient is diagnosed with a urinary tract infection that has ascended from the bladder. In which specific structure would the infection settle if it has reached the kidneys? Is it A. urethra? Or B. ureter? C. renal pelvis? Or D. bladder neck? The answer is C. Pyelonephritis, kidney infection, Occurs when bacteria ascend from bladder through ureter to renal pelvis and kidney tissue. Renal pelvis is the funnel collecting urine from calyces before ureter. Urethra and bladder neck are lower. Ureter is passageway, not settling site. That's it for today. Don't forget to like and subscribe. Tell us how many you scored out of 6 in the comments, and let me know what topic I should post next. Bye.